Coming up on American Medicine Today, type 1 diabetes is on the rise amongst young Americans. However, tracking carbohydrates is not something youth is interested in. Dr. Greg Forlenza tells us about a new device that could detect meals and deliver insulin automatically. Then, Christopher injured his back while cleaning debris after a storm. Finding it difficult to walk or sleep, he contacted the Bonati Spine Institute, and after only one procedure, is back to enjoying life pain-free. Finally, Dr. Bonati discusses the abandoned research behind fusion surgeries and how the medical industry will stop at nothing to cover the truth. Has greed taken over a patient-first mentality? Find out coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon Dr. Alfred Bonati. So health experts are predicting a dramatic surge in type 1 diabetes among young Americans over the next 4 decades. And a new FDA-approved insulin pump system can provide great benefits for those who are affected. Joining us to discuss how it works is Dr. Greg Forlenza, pediatric endocrinologist at the University of Colorado Medicine, and we're also joined by his 15-year-old patient, Izzy. Welcome to the program.
Hello, thanks for having us.
Hello.
So, Dr. Forlenza, let's start with you. Can you briefly explain kind of what type 1 means and what goes into managing blood sugars when you're diabetic?
Yeah, so type 1 diabetes is an autoimmune condition where the immune system destroys the cells in the body that make insulin. And as a result of that, people with type 1 diabetes need both background insulin all the time, as well as multiple doses per day of rapid-acting insulin to cover the sugar in the food that they eat. People with type 1 diabetes generally need to either give multiple injections per day or wear an insulin pump and monitor their blood sugar either with multiple finger sticks per day or use a continuous glucose monitor or a CGM.
My question to you is, why are experts predicting such a dramatic rise over the next 3 or 4 decades? Do you think it's our lifestyle here in this country?
So, as I mentioned, type 1 diabetes is an autoimmune condition, and we're seeing an increase in all autoimmune conditions in the developed world. The rate of type 1 diabetes is currently about 1 in 350 people, and it's increasing by about 2 to 3% per year. We don't think that lifestyle in the sense of unhealthy diet or obesity is driving type 1 diabetes, because we see similar trends in parts of Europe where that's not true. But the usual hypothesis for autoimmune conditions is what we call the cleanliness hypothesis, where the idea is that by having kind of less exposure to less things in our environment, that might be driving up the rate of autoimmune conditions, but we're not really certain exactly why it's happening. We just know that it is happening.
Wow. And Izzy, let's turn to you. What is daily life like living with diabetes? I mean, is it difficult for you and your family?
Well, at the beginning, it certainly was. There's definitely a learning curve. I have to take insulin with every meal, and also I get background insulin from my insulin pump. But at the beginning, I was taking background insulin shots. It's been great having a whole bunch of resources around me, though, because a lot of my family members have diabetes. So yeah.
Well, it certainly helps if your family's been through it too, so they're more understanding about what your needs may be.
Yes.
Tell us about this new insulin pump system, if you will.
My team at Barbara Davis Center here in Denver, Colorado, does research on technology to help improve the lives of people with type 1 diabetes. And so historically, people with type 1 diabetes, as I said, have had to do multiple shots per day and multiple finger sticks per day. We now see more and more people using insulin pumps, so they don't have to give shots. They can just have the pump help deliver their insulin, and they wear continuous glucose monitors, so they don't have to do finger pokes. They can just look at the CGM value on their phone or on their insulin pump. But what's been really, really exciting over the last few years is we've begun to develop what are called automated insulin delivery systems, which is where the insulin pump is listening to the continuous glucose monitor and using computer programs that are like the guidance of a self-driving car, in order to help adjust the insulin delivery rate every 5 minutes in real time to make it so that someone with type 1 diabetes is getting the right amount of insulin for where their blood sugar is and help minimize the amount of high and low blood sugars that they're having. We've been working for about the last 4 years on the Medtronic MiniMed 780G system, so we're very excited to see that now come to market in the United States. And what this system does is not only does it help adjust the background insulin delivery, but it also helps to smooth through meals. And so if people misestimate how much insulin they need for a meal, the system helps make sure that they don't have as high a blood sugar afterwards. And that's really, really exciting to offer to our patients and their families because people do better with less work and feel more successful in what they're doing.
I don't know if you're familiar or not with the CRISPR-9 technology. Really, that is practically designed to correct this type of abnormalities. And instead to be creating medications, you can directly treat the genome, remove that genetic problem there, and not only the family, but also the patients can be treated in that way. Are you familiar with something like that?
Yeah. So what you're asking about is something called CRISPR technology, and it's the idea of real-time DNA editing. Unfortunately, type 1 diabetes doesn't have a sort of simple inheritance pattern. We know that genetics play a small role in the development of diabetes, but 80% of the people we take care of with type 1 diabetes don't have any known family members with type 1 diabetes. Also, by the time we're seeing someone present with the typical signs and symptoms of type 1 diabetes, increased thirst, increased urination, unexplained weight loss, their immune system has already wiped out the cells in the body that make insulin. And so even if you were able to go in and make it so that the body wasn't reacting as much to the cells that make insulin, that wouldn't make those cells come back. Those cells are already gone. So our hope is that technology like CRISPR can be used in the future for things like islet transplantation to make islets that the immune system isn't seeing. But that is a very conceptual idea right now and is very far away from human therapy, which is why we're very excited to see things like the 780G system come out, where something that we started researching 4 years ago is now being used by people in their daily lives.
And speaking about daily lives, Izzy, how is it affecting your diabetes? How is this pump managing that? And then overnight, and really, how is it affecting your daily routine?
This insulin pump has made my life so much easier. With the 780G, I can monitor my blood sugars with my CGM connected to my insulin pump. They talk to each other, and the insulin pump gives me insulin based on my blood sugars. Additionally, it makes meal times so much easier. Like if I accidentally miscalculate or forget to bolus, it prevents me from going super high. Additionally, when I'm exercising, I can set a temp target that helps my blood sugars stay where they need to be. It also talks to my parents' phones, an app on their phone that helps that gives them the information like about my blood sugars, how much insulin I have.
What can someone as young as Izzy and every other American and people around the world really that are suffering from type 1 diabetes, what can they look forward to? I mean, obviously this is a great advancement, but 5, 10, 15, 20 years from now, where is the science headed?
So the science in this area is headed towards more use of cutting edge computing, artificial intelligence, deep machine learning, so that in the future we'll be able to make it so that hopefully users don't have to interact with their system except when the system is malfunctioning. And we can make it so that people with diabetes can worry less about the foods that they're eating when they're exercising and thinking about their blood sugars and spend more time just being normal kids and normal healthy adults, and having the technology make it so that more and more daily tasks are achieved by the technology rather than the user or their family worrying about it. So I don't think these things will make diabetes go away, but they will hopefully make it so that diabetes is much less stressful and management is much more successful so that people achieve better outcomes with less work and have less complications long term, the point where we think there should be no complications in the future with normalization of blood sugar values.
Perfect. Well, we surely appreciate both you, Dr. Greg Forlenza, and your 15-year-old patient, Izzy, for joining us on the program. Make sure you stay tuned. Coming up after the break, a story of recovery.
World-renowned Dr. Bonati created the Bonati Spine procedures to minimize surgery scarring and recovery. 75,000 procedures have resulted in 98.75% satisfaction. Over half our patients suffer from failed surgeries at other facilities. Visit AskBonati.com. In September 2017, Hurricane Irma affected the lives of people in the Caribbean, Puerto Rico, Cuba, Florida, and more. For Dr. Christopher Forsey, the pain of Irma extended well after the storm had passed.
I own a private practice, and it's comprehensive family dentistry. I think it's over a lifetime of abuse. I've had a previous back surgery about 6 years ago, and the visit to Bonati it stemmed from Hurricane Irma cleanup. I had an incident, lift the wrong thing the wrong way. You know, most of us think we can be 18 forever, and it doesn't work out that way.
He described his symptoms and the limitations that developed over time.
The pains that started generally was kind of isolated to the back. Over the next several months, it started translating down the hip, back through the right side of my buttock, down the leg to the outside of my leg, all the way across the top of my foot. I had some numbness with it. And then the neurological symptom that I had, I could not control the foot, lifting of the foot. So when I walked, the foot would drop. Getting up in the morning, really difficult. I have not been sleeping in my bed, sleeping in the floor, flat with my feet elevated on the couch. That's where I slept every night for 2-3 hours a night. I could not sleep. The pain was so intense it wakes you up. And then I'd get up and walk. And then once I got going, I'd get to the office and try to move through the day as best I could.
Dr. Forsey looked into natural remedies to treat his pain.
I have a very close friend who's a chiropractor, and starting with the initial injury, he did a few adjustments, maybe half a dozen or so. They would help, but it would not, it would come back in a day or two. It just never would completely resolve. He had me, he would give me a stem unit on weekends, and I used that with mild success. And between that and just the anti-inflammatory agents, and then diet. I'm big on eating and consuming non-inflammatory food, staying away from the pro-inflammatory side of things. And if I ate something wrong, it was immediately noticed. The pain intensified.
Once he could no longer live with his pain, he began a search for a physician who could help.
You'd watch a television and then you'd see the Bonati Spine Institute on a commercial. And I'd seen a number of the bio-spine people and the laser spine people and all, those kinds of things. And my chiropractic friend that I was seeing, I asked him, I said, have you ever had anybody use these minimally invasive techniques? And he said, yeah. He said, with really great success. He said, a lot of them have gone to the Bonati Institute. And I said, okay, yeah. I said, I've seen those on television. The Laser Spine Institute, I talked to a number of patients that had actually been there and they hadn't had really good results. But 100% of the people that I had asked questions about that have been here, everybody had positive things to say. And so my research basically, I ended up kind of understanding that Dr. Bonati he was the pioneer. He was the guy that created the procedure. And so in my mind, it was why go to somebody else when I can go to somebody that has been doing more of it in a longer period of time than anybody that's out there.
After deciding to contact the Bonati Spine Institute, Dr. Forsey spoke with a patient advocate who arranged his in-person consultation and evaluation.
Getting here, he came into the room, Dr. Bonati himself, did the consultation. He said, from what your injuries are, from what I'm seeing on the MRI, he went screen by screen through everything, and he said, the pain is here, 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 and here, and here. He said, is that where your pain is? And I said, that's exactly where it is. He knew exactly. His experience level with his diagnostic abilities are unreal.
The patented Bonati Spine procedures are performed using conscious IV sedation. Dr. Forsey explains how this technique works, why it is so important in ensuring pain relief, and the personal benefit for patients.
The day of surgery, I got here, and John, the OR nurse, the head OR nurse, came in and he started explaining the procedure to me. And through conscious sedation, he said, now when when we get the surgical instruments placed, because they use something called a Bonati tube, and the Bonati tube is inserted to the damaged area, and it allows the doctors to have access to the damage. And then he says, and he starts talking about me being the navigator of pain. And that was interesting. The objective with conscious sedation is to keep you somewhat awake and aware of what's going on. So they coached me in saying my words, that it used one word, whether the pain is in back, hip, leg. They want to know exactly when they work in an area, they want to know exactly where you feel it. And that is just so they make sure, they ensure that they get your pain dealt with. And that's the absolute importance of doing this procedure under conscious sedation instead of general sedation. During the surgery, they actually have a screen. You're laying face down on the table, of course, with access to the spine, but they have an opening for your face, and there's a screen on the floor, and you can visually see what the doctors are doing. It's exactly what they're seeing, and they will tell you what's going on. Absolutely phenomenal. And that's when they told me, they said, well, you're going to feel here, you're going to have this experience, or you're going to have this sensation. You knew exactly when it was coming.
Just like our surgical guest, caregivers and loved ones of the patients are treated with the utmost respect at the Bonati Spine Institute. They are welcome to accompany our surgical guests throughout their entire Bonati experience. Some even decide to go into the operating room.
Dr. Bonati, at the initial consultation visit, when he came in to do the MRI consultation with me and go over the level of my injury procedure that he'd be doing, my wife was in the room, and he looks at my wife at the end of this end of this consultation, and he says, "So you're coming with him, right?" And she said, "Yes, I'll be bringing him." He looks at her and he says, "No, you're coming with him in the OR." And she says, "What?" And I said, "Oh no." I said, "Doc, you're going to have two patients instead of one if she comes in." And so I looked at him and I said, "So you're okay with having someone in the OR observing?" And he said, "Yes." And I said, "Well," I have two kids that would absolutely, love the opportunity to be a part of this. My wife and I talked about this. There's nothing to hide. There's no smoke, there's no mirrors. He welcomes people, watch what I do. This is what I do. And people like me that sit here and tell people the results of this procedure are outstanding. I mean, and his willingness his response was, "Sure, bring them. I have to educate the next generation."
Though it was only one day after his procedure when he sat down with us, Dr. Forsey is pain-free and ready to live the good life once again.
From day one, experience for me at the Bonati Spine Institute has exceeded all expectation here. From the initial phone call, follow-up, scheduling, the greeters, every single aspect along the way has been seamless. Everybody has showed the highest level of compassion. I can't say anything negative about this place. Anybody that has pain, it's living in pain, doubts, fears, anxiety from surgery, from a procedure, don't live in pain. Consult these people. This is an outstanding group of people, very well educated and compassionate and passionate about what they do in delivering, a pain-free lifestyle. Return to what you do, and that's the end result: is live with pain or live a good life. And that's what I chose. So here I am.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, So 6 days, and everybody was in awe, like, "Didn't you just get out of surgery?" I'm like, "Yeah, I feel great. And like, let's see how you do. And rolling with everybody, and I'm in the advanced class. That sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. So, Doc, we had a guest on recently that talked about failures of fusions and kind of the hidden research that they promoted to make it sound like it's a good thing for patients, but it's not. Why don't you elaborate?
We have a tremendous amount of difference of opinion about how to treat the spine.
Sure.
And I am a voice for 10 years that is not very welcome because I don't believe that fusions ever should be done in a patient. If you will see some of the people who come to see us, they have fusions that practically they have more screws and plates and tubes there than bone.
Correct.
So I disagree with that treatment. I don't think is beneficial because you're treating a substance that is alive. The bone is an alive structure.
All right.
And if you put a screw in that area, it's not like you put a screw in a wood.
Right.
You're putting in something that is alive. So by being alive means it's going to have the tendency to reject that, even if it is an inert substance like steel or gold. The body starts to make that area weaker. And then what it's trying to do is trying to get rid of that element that was placed there that doesn't belong to the body. When you talk about fusions, we talk about that 65% of fusions are going to fail in 2 years.
Right.
If it is only one level, if it is 2 levels or more, they go back to 85% of fusions fail in 2 years.
It's absurd.
Well, if you start to see that in United States, we operate around 760,000 people a year is being operated in the United States for back problems. And if you look, that 460,000 people is fusions.
Wow, that's
you
staggering.
start to see the tremendous amount of bad surgery that is being done in people that they are young. If you're talking about somebody of 50 years old, 60 years old, today with the new advances in medicine, the whole thing, these people is around in the 30s. They are active, they look young, they do good. And if you put this mess in their back, you are curtailing years of life.
Yeah.
I'm being attacked all my life.
Right.
I'm being attacked by organizations that are agencies of healthcare or board of medicine.
Sure.
And the attack is relentless and constant and doesn't stop. Number one, you need to understand that the industry has a lot of power. And if you're talking about 760,000 people operated, 460 are fusions.
Correct.
Imagine the economy that is being wasted doing that procedure that is going to create cripples and is going to create people that they will require later to do more surgeries. And more surgeries you do, more fusions you do.
Correct.
So I think what you need to do is you need to change the direction. Well, I changed the direction. And every time that I change the direction, I have horrible attacks. And the most important thing is when you are being attacked, the people are, the population of the country are being misinformed. And that misinformation goes to the regular people. The mind of these people is being tinted. We are going to lose an institute that today in the world is probably the only place where we have a patient satisfaction on 98.7%, is almost 99%.
98.75% patient-reported satisfaction. So it's not surgeons saying we did well. It's the patient and their superior results that are speaking for themselves. And you're able to do these things with no hardware, no devices. And that industry is massive. And it's really all based upon research that they never finished. And they actually had other papers come out saying how ineffective and how horrible fusion surgery was for the patients, that they undo in the bone, they mangle and tangle in the nerves, and it just causes a chain reaction in the body. And you knew this deficiency decades ago. And you've been doing your procedures for that long, giving true patient pain resolution.
Well, we have procedures performed at the Institute on the 75,000 people.
Procedures performed.
Let me tell you this. These procedures, they gave to patients a different life, different future.
Yes.
Okay, and they have activities that they already curtail for years, some of these people. Some people were on the wheelchairs.
Yes.
The major trouble with this is when you have a misinformation or you have agencies of healthcare that they don't really understand well what is going on. They don't do the proper research. They don't understand really the damage that they can do. And then suddenly they start to attack a procedure like this. The next thing that happens is very easy for me to quit. Now, who is going to give these results? Despite that I teach some of the physicians in the whole thing, they don't have 75,000 procedures performed. So this capacity doesn't exist today in the world.
You paved the path for every other doctor in the industry. You were that pioneer that was ridiculed for what you do, and now minimally invasive spine surgery, not specifically what you do, because no one's been able to duplicate what you do or the success rate, but you paved that path. You took the attacks and you kept on going.
Well, we develop a technique that avoid the incision on the body and just use a tubes to be able to get to where you need to go. That imagine the amount of pain and suffering that we remove just with that technique.
We'll continue to bring you the miraculous recoveries and information about the Bonati Spine Institute. To find out if you're a candidate, visit AskBonati.com, and to see previous episodes of our program, check out Rumble and search American Medicine Today. Thank you for watching. If you have any comments or questions, contact us at the numbers below, or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. And to catch previous episodes of American Medicine Today, search the Bonati Spine Institute on YouTube and Rumble.